milligram per kg, slow IV has to be followed, but it takes a longer time for the recovery, because whenever there is a clotting factors are totally exhausted, you cannot generate them suddenly. The whole blood transfusion is one of the best method, and the very fast recovery also. So zinc phosphide is the one. We do not have any specific antidote and causes the release of the phosphine gas and irritates. So these are all the zinc phosphide, the thing, especially it causes severe colic in the animals and aimless running in the dogs, regurgitation of the food with blood mixed, depression, etc. No specific antidote available. We have to treat symptomatically. Here is an episode which is reported by Dr. Renuka Prasad when he was the director of IHUB. They exhumed one carcass after 8 days of its death. It was a malicious poisoning by this especially zinc phosphide. They took it out after 8 days. The carcass was very fresh after 8 days also, especially in zinc phosphide gas poisoning. It is converted to a toxic gas known as the phosphine, and it is having very high capacity to inhibit the post-mortem invaders. Hence, the carcass remains very fresh even after 8 days also. So, examined carcass, especially of the animals, then they took out the carcass. It was as fresh as a immediately died animal even after 8 days also. You can see the fresh rumen content, especially yes, the Mysore Zoo animals. As case I think you may remember the episode that 3 elephants died in the Mysore Zoo. It was a purposeful poisoning by the local attendants to take revenge on the higher officers. So it was the post-mortem was conducted, and the congestion of the mucosa I can see, cyanotic tongue, then endocardial hemorrhages, all due to the zinc phosphide poisoning. There is no specific antidote for this. You can see emphysematous lungs, etc. Large intestine with ecchymotic hemorrhages. Then it was confirmed in the laboratory that it is due to zinc phosphide poisoning. So all these type of the poisoning cases may come in field conditions or to the wild animals also. There is no change, and there are specific field tests also. We can have the pH paper tests, etc. are there, and we can conduct. So this is about the pharmacology and toxicological aspects of the wild animals is concerned, because it's a, of course, we are teaching in 2 years to the wildlife specialist course, and also as a 1 semester course to the students, and it's maybe a very difficult thing to cover. But to a field veterinarian, this much knowledge is enough, as I know, so that you can handle the wild animals pharmacologically, you can restrain it, and the list of the drugs you know, then common poisonings, and I am going to complete my seminar over here, and if you have any questions you can ask in any type of the poisonings.